Hello, everyone. I'm Mike Schlosser, the Chief Transformation Officer for HCA Healthcare. Excited to bring you today the Meet the Innovator series. This series, we are highlighting leaders and frontline change agents who are helping us create the new data-driven, clinically led approach to care delivery across HCA Healthcare. I have with me today Erica Rosito, who's Senior Vice President and Assistant Chief Nurse Executive for HCA Healthcare. Erica, thanks for joining us.
Yeah, happy to be here.
Excellent. We're looking forward to talking to you a little bit about your role with DT&I and how you're helping lead change across the organization. So why don't we start with a little bit about you and your background? What was the inspiration that got you into healthcare or maybe into innovation in the first place?
So for healthcare, for me, I grew up with two working parents. Spent a lot of time with my favorite aunt in her household with her children as my parents were working, and a cousin of mine who was just a couple years younger than me in age actually had childhood cancer, neuroblastoma. And so I lived with that for my entire childhood, going in and out of hospitals with him, with his family, with my family, cross-covering, babysitting. And it was always just intriguing to me. I think it was the science of it as well as the aspect of caring for people. I do like to be a little humorous about it. At one point in time, I thought I wanted to go into pediatrics because that's what I knew, and I couldn't make it through the health department rotation where you had to give immunizations to children, and they cried. So that did not work for me. But I think the appeal to me, in addition to just what we do every day, was a continued exposure throughout my childhood. So from a grandmother to the aunt that I referred to earlier, to a close friend in high school, just various people in my life having different healthcare experiences, often not for the better. And I found myself in nursing school, and within like my first clinical rotation was hooked and just inspired by the instructors I had, the charge nurses that I saw, the leaders that they were, and I felt like it brought everything I like to do all together. The science aspect, helping people, and I also love teaching. And so it's just a well-rounded place for me to be.
Well, that's awesome. It's always interesting to me how many people who are leaders in healthcare have those personal experiences that drove them to the industry. And so clearly it just speaks to the passion and the calling that this is for a lot of people. And you've obviously had an amazing career, a meteoric rise since those early days as a nurse. And so now our Senior Vice President and ACNE, and also serve as the business unit sponsor for care team optimization within DT&I, which is a role we're very blessed to have you serving in. But tell us a little bit about that. What is care team optimization and what does a business unit sponsor do?
Yeah. So care team optimization is, to me, all about making things more efficient and effective for our nurse leaders, for our bedside staff, and therefore allowing them to spend more time with their patients, and how we leverage technology, leverage AI, leverage large language models and machine learning to be able to introduce technology and innovation that can do that for them. As the business unit sponsor, I get to work really closely with Sarah Bryant, who we are so fortunate to have. Sarah is a nurse by background, and just brings a wealth of not just innovative spirit, but also realistic clinical knowledge of what it's like to be a bedside nurse. And I think she brings a different level of energy to our team that helps us achieve the things that we set out to achieve, and introducing things that can allow our nurse leaders to spend more time with their staff and allow our staff to spend more time with their patients.
Yeah. And bringing those new technologies to staff, obviously we're trying to, like you said, help them make their jobs and their lives better, but it's not necessarily easy all the time. It's a lot of change that folks have to go through. And so I know you take on a lot of responsibility as the business unit sponsor to help lead that change for the organization, which we're incredibly appreciative of. So let's talk a little bit about the work. Is there one particular project or product that you and Sarah are helping lead that you want to focus on, you want to let our viewers know about?
Yeah, top of mind is our Nurse Handoff tool, which really in its simplest form is a tool developed for our nurses by our nurses at HCA Healthcare to help hand off patients in a more efficient and effective way. And I love talking about that because it's not just bringing technology and innovation into the space, but I think our approach. And so for those who are not aware, the Nurse Handoff tool is a tool that uses AI and large language models to, for lack of better terms, my term, scrape the patient's medical record and bring forward information that two nurses would want to hand off during shift report. And by bringing that information forward, it helps our nurses be more confident in what they're reporting. Our newer nurses are sharing that they're no longer fearful of giving report to more experienced nurses because they're not worried they're going to forget something in our pilot sites. But it also allows us to get input from our nurses. So instead of buying a tool off the shelf, which I'm sure we could do, that would do this for us, we are building the tool alongside HCA nurses, and they are giving feedback and training the model all along the way. And that's what makes it unique to me, and what makes it unique to something we're doing in HCA to support our nurses maybe differently than some other systems.
Yeah, and that front level voice in our innovation is such an important part of our process. And we've actually highlighted that in some of our previous Meet the Innovators, some of those frontline leaders and staff that have gotten their handprints right in on the technology. And it's important for driving adoption too, because the tool is designed to meet their needs, which we think is really impactful. So speaking of those frontline leaders, as the assistant chief nurse executive for the company, you get to touch so many lives across the entire company. And I'm sure there are some young folks out there who are interested in innovation, interested in this kind of digital work that we're doing. What advice would you give to them? What words of wisdom can you impart as they're beginning their journey with HCA Healthcare?
Yeah, I think two things come to mind. One, and you mentioned it a little bit, but the as exciting as any of these innovations in technology may be, they are changes. And so the more that we can understand the change, understand the envision, immerse ourselves in the why, and be able to live and breathe and articulate that, I think the better off we'll be. And then the other thing I would say is always say yes. It takes people wanting to be creative, kind of pushing the envelope, saying yes, and not pushing back on the change and the, oh, we can't do it that way because we never have, but being willing to say yes and accept the change, and then take that leap of faith into what you think the possibilities could be. And we need our frontline caregivers, our frontline leaders to be bringing forward those ideas and innovations for us. And so using their voice and highlighting those things for us is a great way to get started.
Well, that's terrific, and a great way to end this conversation. Erica, thanks so much for everything you do for our patients and our staff, as well as for DT&I. It's a pleasure to have you here today.
Thanks for having me.